Have you ever thought about why things down there don't seem to work as well, even when you're doing everything right? You work out, you make an effort to eat healthy, you have even talked to your doctor. But firmness, lasting strength, and assurance don't feel the same as they used to. You're not the only one who has heard that before, especially beyond 60. You probably did your best. You are not a slacker. You are not broken. Most men do everything they know how to do. But there is often something going on behind the scenes that changes slowly, quietly, and without anyone noticing. And when you finally see it, it can seem like it came out of nowhere. Things down there don't seem to work as well, even when you're doing everything right. You work out, you make an effort to eat healthy, you have even talked to your doctor. But firmness, lasting strength, and assurance don't feel the same as they used to. You're not the only one who has heard that before, especially beyond 60. You probably did your best. You are not a slacker. You are not broken. Most men do everything they know how to do, but there is often something going on behind the scenes that changes slowly, quietly, and without anyone noticing. And when you finally see it, it can seem like it came out of nowhere. Stay with me because in the next few minutes, I'm going to explain that hidden component, show you how to work with your body instead of against it, and tell you about one secret weapon that most seniors don't know about because it's so simple. You might be astonished at how quickly things can change when you deal with the genuine problem in the appropriate order and with actions that are easy for seniors to follow. Now, I'm going to be honest and polite. We'll make the science simple and easy to understand. We'll utilize instances that make sense after 60, and we'll softly reiterate important points so they stick. First, let's speak about how urgent it is. The difficulty that a lot of men have beyond 60 doesn't come with warnings. It sneaks in. There is no sound. It happens slowly. It grows over time without you even knowing it. You wake up one day and the firmness that used to happen on its own now needs more time, more stimulation, or occasionally it just doesn't happen. That can be more than simply annoying. It can disturb your confidence, closeness, and even your freedom. Why do you want to be independent? This is because sexual health is closely linked to mood, energy, mobility, and heart health. If one person falls, the others will too. If we ignore it for too long, we might become more reliant on drugs, timing, and luck. We don't want to go that way. So what is the secret enemy? In plain English, it's a sluggish, vascular slowdown and some pelvic support that isn't working as well as it should. Blood flows to the penis during an erection. Picture pipes, pressure, and valves. After age 60, your blood vessels can get stiffer, your circulation can dip if you don't walk around as much, and your pelvic floor and smooth muscle can lose coordination if you don't use them. Stress and not getting enough sleep can make the body's fight or flight response stronger, which makes the system shut down when you need it to switch on the most. You haven't done anything wrong because of any of this. It suggests the system requires a tune-up that is suited for people over 60. In simple terms, here's the authority bridge. Both urology and cardiology concur that erectile function is a sign of vascular health. Sildenafil and tadalafil are two drugs that can help since they expand blood arteries and keep blood where you need it. Many professional guidelines say that these drugs are a standard choice when they are acceptable. But here's the catch. Medicines operate best when the foundation, circulation, pelvic support, and nervous system calm is in good shape. Most people don't know that changes to their lifestyle can help that foundation at any age. After 60, the appropriate order is important. So let's count down a strategy that is useful and easy for seniors to follow. We'll start with 3 warnings about what to stay away from or cut back on, and then we'll give you 5 alternatives you can start using right away. I'll put them in order from number 8 to number 1, and I'll tease the number 1 along the way. Stay with me for the number 1 change that most seniors don't expect. Number 8. Warning: not paying attention to cholesterol, blood sugar, and blood pressure. When these levels are high or change quickly, blood flow to sensitive tissues is affected. That means that over time, your erections will be slower, softer, or less consistent. In simple terms, think of your arteries as garden hoses that may bend. Over time, high blood pressure, hyperglycemia, and LDL might make the hose stiffer and smaller. Less elasticity implies that blood doesn't flow as quickly when you want it to. Personal effects: slower response, less firmness, greater frustration, and less confidence. You can also lose some energy and mobility. If you haven't had a checkup in the last 6 to 12 months, make an appointment. Request a simple circulation check and a review of your medications from your doctor. If you use a home blood pressure cuff, Your doctor should tell you to strive for a reading while you're calm and relaxed. Stay on top of your follow-ups. This one step makes everything else on this list work. What's worse is that a lot of men avoid this because they think they're fine. Keep in mind that this is a quiet mistake. It grows without you even knowing it. Number 7. Warning. Smoking and vaping, even just a few. After 60, nicotine and smoking chemicals make blood vessels tighter and harm their lining. Even a little bit of use builds up over time. Science. In simple terms, the inside of your arteries should be smooth and calm. The chemicals in smoking and nicotine can make that surface feel tight and itchy. Less blood flows through tight conduits. Personal effects. Slower stir-up, poorer maintenance, and more nights when you can't sleep. If quitting seems like a big deal, make a strategy to cut back. Take one cigarette out at a time. Make an appointment with a quit line or clinic. A lot of men say that getting treatment and using nicotine replacement therapy, if needed, together works. Every step promotes blood flow. What's worse is that a lot of older people think, "I've smoked this long, what's the point?" Here's the twist. Circulation can start to get better within weeks of cutting back. It's never too late to help your blood vessels. Number 6. Warning. Sitting for a long time, having stiff hips, and not getting enough sleep. After 60, sitting for long periods of time slows down pelvic circulation. Tight hips compress nerves and blood vessels, and short, fragmented sleep raises stress hormones that stop sexual response. Your heart moves blood, but muscular pumps also help. Those pumps stop working when you sit for a long time. The body stays in fight or flight mode instead of rest and respond when it doesn't get enough sleep. Personal effects. Feeling numb, stiff, tired, and uninterested, which leads to diminished confidence. Set a gentle timer to remind you to stand up every 30 to 45 minutes. 10 calf raises and 10 gentle hip hinges are what you should do. Try to sleep at the same time every night. Turn down the lights an hour before bed. Put a small notebook by your bed to write down your anxieties. Little things build up. What's worse is that we get used to feeling stiff and stop experiencing it. Another mistake that goes unnoticed, growing without even knowing it. Now we move on to solutions. These are the builders, the routines that keep your vasculature, pelvic floor, and nervous system healthy. And sure, if your doctor thinks it's okay, drugs can still be part of the plan. But these things can make the drugs operate better and maybe even make you less dependent on them. Number 5. The answer is pelvic floor training, which includes doing Kegel exercises the appropriate way. After 60, the pelvic floor, which is a group of muscles that help with erection, ejaculation, and bladder control, might get weaker or lose timing. Science plain. These muscles assist keep blood in the right location at the appropriate time. Blood leaks out when they are weak or not working together, and stiffness goes away. Personal effects. Dribbles, less control, faster completion, or trouble staying solid. Simple action. To find the muscles, halt your pee stream once. Don't exercise on the toilet. Start with 10 slow reps away from the bathroom. For 5 seconds, squeeze lightly, then relax completely for 5 seconds. Do 2 to 3 sets per day. Be consistent for at least 6 weeks. Take a breath. Exhale slowly as you squeeze and inhale as you relax. If your butt, tummy, or face is tense, relax. Accuracy is better than strength. Here's the twist. Relaxing is just as crucial as contracting. A tight, fatigued pelvic floor might cause problems. Every squeeze should be followed by a full, smooth release. Number 4. Solution. The 20-minute engine, which is easy on the joints and good for cardio. After 60, a lot of men think they need to work out really hard. That can make joints and backs hurt, and then they do nothing. Science. Plain. Walking or biking at a slow to moderate pace increases nitric oxide, which relaxes blood vessels and maintains the pipes receptive. Muscles are like pumps that move blood where it needs to go. Personal effects. Increased energy every day, a better mood, and a more reliable response. Easy step. Walk for 20 minutes most days. If you're worried about your balance, pick a safe loop, a mall, or a treadmill with handrails. That's fine if you like to ride a bike or do water aerobics. The most important thing is to be consistent. Try to find a speed where you can talk but not sing. A quick 10-minute walk after supper is a wonderful extra. Drink water during the day, not just at night. Stopping all activity to rest will often make stiffness and circulation worse. Gentle is good. It's better to be done than perfect. Number 3. The answer is vacuum therapy, a penile pump administered correctly. Problem after 60. Some men have trouble getting blood to flow into the erectile tissue when they want it to, even if they have healthy habits. A vacuum device generates a moderate negative pressure around the penis, which pulls blood into the erectile areas. A delicate ring at the base can assist maintain blood in place for sex. Personal effects: more regular fullness, practice for the blood vessels, and occasionally a better reaction to medicine. Simple action: get help from a doctor or skilled professional to pick the proper cylinder and ring. The average session lasts 10 to 15 minutes. For vascular training, a lot of men undertake 2-3 sessions a week. Use a water-based lubricant to preserve your skin. If you feel pain, bruising, or numbness, stop and ask for help. It matters to have the right fit and to use a gentle manner. Let me make it clear: greater suction is not better. The winner is steady, comfortable pressure. Instead of test of toughness, think therapy. Number 2. Solution: penile traction therapy, a structured extender that helps with blood flow and tissue suppleness. After age 60, the tissue may not be as stretchy, and blood may not flow evenly. Science: plain. Gentle, steady pulling on tissue tells it to change shape over time. Some guys remark that their length has risen, but more importantly, many notice that their tissue quality and blood flow have improved. Personal effects: possible better erections in terms of quality, angle, and comfort. When the system starts to respond again, confidence comes back. Simple action: use a medically designed gadget that fits you well and follow the instructions carefully. Most treatments call for 1 to 2 hours of use every day for 3 to 6 months. Gradually raise the tension, stay the same, and avoid any pain. If your skin is numb or you have other problems, stop and talk to a doctor about your setup. Here's the twist: traction isn't just for looks. Regular, mild stretching can help keep tissue healthy. Therefore, it's typically utilized in rehab plans, including after prostate surgery. Stay with me because number 1 is surprising, easy, and often missed. It helps even when you're doing everything else perfectly. Number 1. Grand reveal. Slow nasal breathing can help calm the fight or flight response in the nervous system. Most seniors are shocked by this secret weapon. You can have good circulation and a firm pelvic floor, but if your nervous system is on high alert, you may not be able to get aroused. When you're stressed, worried about how well you're doing, or not getting enough sleep, your body goes into fight or flight. In this state, blood is pushed away from the pelvis. It's a setting for survival, not for making connections. Science: plain. Breathing slowly and steadily via your nose helps your body get into the rest and respond condition, which is the parasympathetic state. That's when the pelvic floor works together, blood vessels relax, and sensory messages get stronger. Less mental noise, easier arousal, better feeling, and increased staying power, especially beyond age 60. Simple action: practice for 5 to 10 minutes every day and again on evenings when you expect to be intimate. Stand up straight. For around 4 to 5 seconds, breathe in through your nostrils. Breathe out through your nostrils for 6 to 7 seconds. Relax your shoulders. If counting is too hard, just focus on taking deep, quiet, gently breaths. Take a warm shower or a short walk to let your body relax. A lot of men say that this basic routine makes a big difference. Back to what we said at the beginning. You've worked hard. You didn't lack willpower, you just didn't have a switch. By saying no to fight or flight, you let your pelvic muscles and blood vessels perform their work. Let's put the full strategy together with specific steps to do today. 1. Book the basics. 8. Set up a check for your blood pressure, blood sugar, and cholesterol if it has been a while. Request a check of your circulation and a review of your medications. If you use heart or prostate medications, talk to your doctor about how they might affect any erectile prescriptions you take. Do not mix PDE5 drugs with nitrates. 2. Cut down on the constrictors. Number 7. Plan how to stop smoking or vaping. Even cutting down helps blood flow. 3. Take the day off. Number 6. Stand up, do 10 calf lifts and 10 gentle hip hinges every 30 to 45 minutes. At night, turn down the brightness on your screens and retain a minimal sleep window. 4. Make the engine. Number 4. Most days, take a 20-minute walk that is easy on the body. If your joints hurt, try doing water exercises or riding a recumbent bike. 5. Teach the valves. Number 5. Do Kegels with full release. 10 mild squeezes for 5 seconds, then rest for 5 seconds. Do this 2 to 3 times a day for 6 weeks. Pair with breathing that is effortless. 6. Use tools wisely. Numbers 3 and 2. If you need to, get a clinician to teach you Hoover therapy and traction. Start small, go gradually, and stick with it. 7. Turn on the switch. Number 1. Every day and before being intimate, practice calm nasal breathing to get into the rest and respond state. Here are a few crucial things to remember to stay safe and feel good. Drugs. When a doctor prescribes PDE5 drugs, many men perform well with them. You can include them in your plan. Always verify beforehand before using them with nitrates or certain other medicines. Supplements. Don't believe everything you hear. Some ingredients may help with circulation or energy in general, but the quality is not always the same. Talk to your doctor if you're thinking about taking any supplements, especially if you take prescriptions for your heart or prostate. Pick well-known brands and don't expect too much. Devices. When used and trained correctly, Hoover devices and traction tools can be helpful. If you feel pain, numbness, or bruising, you should stop and obtain help. Pain or curvature in the pelvis. If you have pain, a big bend, or rapid changes, consult a urologist for personalized care. Let's go over why this method works after 60 again. We talk about the silent mistakes first. Not managing stress and sugar, smoking, sitting too much, and not getting enough sleep. Then we fix the system by moving it gently but regularly, making the pelvic floor work together instead of clamping down, and using devices to transport blood where it needs to go. Lastly, we turn on the nerve system by breathing slowly through your nose so that your body is ready to respond. Putting these steps on top of each other is the paradigm shift. Most individuals try to remedy a problem with more than one part. You will accomplish it in the appropriate order. If you're wondering, is it too late for me? It's not too late. The body can change at any age. Blood vessels may become more reactive. Muscles can get their time back. The nervous system can relax. You can get your confidence back. Change usually happens slowly and quietly, just like the problem did. That's okay. Progress is still progress, even if it's slow. Here's a simple 5-step strategy to get you started this week. Step 1. Get in touch with your clinic today. Make an appointment to get your blood pressure, blood sugar, cholesterol, and circulation checked. If you're thinking about PDE5 possibilities, ask about how they might affect other medications. Step 2. Set a move timer. Every 30 to 45 minutes, get up and do 10 calf lifts, 10 hip hinges, and 5 shoulder rolls. It only takes a minute and keeps the pumps running. Step 3. Turn on the engine for 20 minutes. Walk every day. 3 nights this week, take a 10-minute walk after dinner. Step 4. Gently work out the pelvic floor. Do 10 squeezes for 5 seconds, then 10 releases for 5 seconds, and do this 2-3 times a day for 6 weeks. When you squeeze, let out a breath. When you let go, take a breath. Step 5. Turn the switch on and off every night. For 5 to 10 minutes, sit comfortably and breathe slowly through your nose. Do this again before you get close. If you want to try Hoover or traction therapy, make an appointment with a provider who can fit you and show you how to use it. Practice with guidance is better than guessing. I want to give you some encouragement. You worked hard. You were probably only talking about one part of the puzzle. You now have a plan. Correct the silent problems. Rebuild circulation and pelvic support, and turn on the nervous system switch. Many men notice increased firmness, control, and confidence after doing this, and they often don't have to rely as much on timing and chance. Let's make this interactive, so we can get things going and bring people together. If this makes sense to you and you're ready to try the step-by-step strategy, type 1 in the comments. If it didn't work for you, type 0 and let me know what's missing so I can help. Someone your age who is silently having a hard time will be helped by your story. A little reminder before we finish. This video is meant to teach people in general. It is not medical advice for you. Your case is different, especially if you have heart, prostate, or metabolic problems. Please consult with your doctor to make the steps fit your needs. Finally, a little tease to keep you going. In our next session, we'll speak about a basic after-meal routine that helps with blood sugar, blood flow, and sleep. 3 things that quietly improve sexual health after 60. It's good for seniors and joints, and it goes wonderfully with everything you learned today. Keep in mind that it's not too late. Every little bit helps, and your body enjoys rhythm. Fix the mistakes that don't make any noise. Make the engine. Train the valves. Be smart with your tools, and turn the switch on. I'm cheering for you.